Good morning, everyone. My name is Brandy Binkley. I am the administrator at the Macon County Health Department. It is Monday, March 30th at 10:30 a.m. As of right now, we still have just the 2 confirmed cases of COVID-19 in Macon County that we just announced on Friday evening. Like we keep reminding you, it is very safe to assume, and you should be assuming, that many more people have it in addition to just the 2 confirmed cases. And you should also assume that you could even have it. So everybody should be taking the proactive measures that we, IDPH, CDC, and all of our partners have been promoting in order to prevent the spread of illness and from other people having that. So we just want to make sure everybody knows the medical community, not just public health, but the healthcare systems, the hospitals, the federally qualified health centers, everyone has been working on this in collaboration for quite some time. We are very prepared to respond in any way that it comes through here in Macon County, and it is very important for you all to know that the medical professionals and first responders and everyone is very, very ready to do everything that they can to take care of anyone that has COVID-19 in our community. Part of that equation, though, is that you need to make sure you are staying home whenever you possibly can. If you have an essential reason that you have to get out, go out. If you are sick, you should not be going out at all. It is important for you to do this so that our healthcare system, although very prepared, can also respond in an adequate way for the people that do need health care during this time that they need to be in the hospital. So make sure you're staying home so that you're doing your part, because we all do have a part to play in this. A couple of questions that we've had quite a bit since Friday evening are what we are doing in response to the 2 confirmed cases. Are we letting people know if they've been exposed to these people, and are we letting employers know? The answer to the question is yes. So contact tracing starts as soon as the health department is made aware of a confirmed diagnosis of a communicable disease, including COVID-19. That process starts immediately when we find out, and we follow IDPH protocol and guidance in order to complete that contact tracing. We have contacted the appropriate people whom have come into contact with the people in the time frame that was provided by the IDPH protocol. So if that would have been you, you would have been contacted. And again, if there is a diagnosis in the future, and I'm sure that there will be, you would be contacted if you had been exposed in the way that IDPH protocol dictates. Also, if you're an employer and you have an employee that is a confirmed diagnosis, if you are at risk of exposure based on that person's attendance at work recently and within the time frame provided by IDPH protocol, you would be notified as appropriate. Only confidential information would be provided to the appropriate parties in that employer organization, and it is important that it is kept confidential. But then you are provided with direction on how to behave appropriately if you or your workplace has come into contact with a confirmed diagnosis of COVID-19. If you have additional questions about what happens after we do find out about a confirmed diagnosis, if you have questions about isolation, quarantine, and what the difference is between these 2 things, please check out our website or our Facebook page. Thank you.
Thank you, Brandy, for your leadership in this matter. I'm Scott Wrighton. I'm the city manager of Decatur, and in addition to the helpful comments that Brandy just gave, many of you may have received, although some did not, the White House sent out a postcard to every postal address in the United States that says President Trump's coronavirus guidelines for America, and on the back side it mentions a lot of the really helpful points and guidelines that Brandy has been talking about, and more information about that is at coronavirus.gov. I want to talk a little bit about some of the things that are going on specifically with regard to the city and some other organizations in town that don't touch on some of the medical issues. The first is that the United States Census Bureau has discontinued or suspended for a little while the census operation. There's been a lot of information in the media about how important the census is, and it is important. But their field operations are going to be stopped until April 15th at the earliest, and now with the president's decision to extend the stay-at-home order till the end of April, it could be longer than that. But you can still respond to the census online or by mail, and many of you have received numerous letters from the Census Bureau about that, and we encourage you to send those back and fill them out, because if you do that, then there won't be anybody who comes to your house eventually whenever the Census Bureau does resume their field operations. We had a very successful mask drop-off last Thursday here at the Civic Center, and that's going to continue this coming Thursday on April 2nd and the following Thursday on April the 9th. One of the things that local medical professionals are struggling with, although they have a lot of things all set up and ready to go, but there is still a shortage of personal protective equipment, and that'll help us in that area. Those of you who are small businesses in the category of liquor license holders, we want to remind you that even though you're all struggling and doing some really creative work to provide for curbside pickup and delivery and other sorts of arrangements that are outside of the restaurant. The governor has issued an order through the end of the stay-at-home period on April 7 that says that liquor license holders cannot have available as a part of some curbside food pickup a to-go package, a to-go cup of some alcoholic beverage. You can only have that as a part of a curbside pickup sale if the alcoholic beverages are in the original and sealed container, and that's per the Illinois code, and that hasn't been waived because of the emergency. The city of Decatur is also making some adjustments with regard to enforcement of its downtown parking. Beginning today, we will suspend any enforcement of downtown parking except for those on-street lots that have a specific registration or permit number assigned to them. And that's usually written on the sign. Those are spaces that somebody has paid for, and so those will continue to be enforced. But we're not going to cite somebody who's in a 2-hour zone if they're there for 4 hours, or if they're in one of the parking garages. Only the ones that are identified with a specific permit registration number. Again, back to small businesses, the Department of Commerce and Economic Opportunity has a hotline for business assistance. That hotline will help with short-term grants and loans that are available to small businesses, and the City of Decatur's website has that link to DCEO. Nicole Bateman from the Economic Development Council is going to be talking a little bit more about those programs here in just a second. I'm going to give her the podium. The last thing I want to mention is that the State Treasurer of Illinois has also added some additional benefits by putting more capital into the state's linked deposit program, specifically to help small businesses with loans at a very low interest during these difficult times, loans for up to 1 year. These loans, however, are usually available through your local bank, and usually for businesses that have assets less than $1 million. So talk to your local banker about that. So I'm going to turn it over to Nicole Bateman now from the Economic Development Council.
Thank you, City Manager Wrighton. As he noted, there are a lot of opportunities right now and more coming to help small businesses here in Decatur and Macon County, and one of which I wanted to make you aware of today is the Hospitality Emergency Grant Program for our local restaurant, bars, and hotels. Many of the loans or grant opportunities that are coming our way will not have deadlines, but this one does. And so please, if you are interested in participating in this, you must fill out the complete application, have it submitted by 5 o'clock on Wednesday, April 1st. That's this Wednesday, April 1st by 5 o'clock. These are for bars and restaurants and also hotels. And depending on the amount of revenue that you have brought in will depend on the amount of the grant that you may be eligible for. Now, this grant is a little unique in that it will be awarded through a lottery system. So just because you fill out the application does not necessarily mean that you will receive the grant. However, there are other opportunities available for working capital, as City Manager Wrighton had described. And so we wanted to make sure that you were available with the emergency grant program for the hospitality industry that's due this Wednesday. There are other programs available. There's the SBA, the Small Business Administration disaster loans. There's also a downstate small business loan and grant program available as well, and others. And so what I want to encourage you to do, if you're a small business owner here in our community, to check out our website, Decatur EDC, that's DecaturEDC.com. There's a COVID-19 tab, and we are, as we receive information from the Department of Commerce and Economic Opportunity and the Governor's Office, in cooperation with the City of Decatur in Macon County, publishing information as soon as we have it on what those relief opportunities and loan opportunities are available to our local small businesses. So please check that out. Don't hesitate to contact us. There is a contact form on that website as well. Again, it's DecaturEDC.com.